This PowerPoint, we are going to share about the few clinical cases related topic about OBG. OB stand for obstetrics and G for gynecology. The basic difference between obstetrics and gynecology, obstetrics, shortly called OB, it involves the care during the pre-conception, like a mother have a plan to get conceived or have a plan to get a baby. So pre-conception and care during the pregnancies, childbirth, and immediate after the delivery. All of the phase we discuss or care in obstetrics phase. The gynecology, shortly called GYN, involves the care of all women's health issues. Example, ovarian tumor, fibroid, menstrual irregularities, cervix problem, infertilities, all are gynecological issues. So here, first of all, in obstetrics and gynecology, here focusing the IV medications. So intravenous access should be a large bore needle. Basically, we used. And this is the most common one is 18 gauge is preferable. And main line is always lactate ringer. So you see the bag contain the solution, this is called lactate ringer solution. The lactate ringer or ringer solution was developed in the late 18, right? And the ringer for the keeping the organ hydrated during the like any medical emergencies, constantly live. The basic medical use lactate ringer solution is widely used to replace the lost fluid and to aid with certain intravenous procedure. In NCLEX board exam, a frequently asked question, in case of burn, what solution we use? We use the lactate ringer solution. And also proximal port is always reserved by Pitocin when the Pitocin is ordered by medical doctor. Pitocin is hung with separate primary tubing and must always be on his own palm. So if a patient needs Pitocin and lactate ringer solution, we always use two different channels, right? Very important. And always another antibiotics are hang the piggy bank to lactate ringer line and also programmed as a secondary. Here we are going to focus a little bit more about the Pitocin. So particularly Pitocin is a synthetic uterotonic medication, and meaning causes the uterus contract. So if you ask me, when we use the Pitocin, right? So Pitocin is a synthetic version of the natural producing hormone oxytocin. So generic name is oxytocin. Our body can produce oxytocin But when the oxytocin you made in the laboratory, this is Pitocin. So I said Pitocin is a synthetic version of the naturally producing hormone called oxytocin. And this hormone's main function is to help with milk excretion during the breastfeeding. But the hormone also play an important role during the labor by stimulating the uterus and making it contract. So, little bit more information about the Pitocin. It is a high-risk medication. So, if my patient under the Pitocin treatment, we need continuous monitoring. Also given IV during labor or postpartum phase. Unit of measurement is in ml per hour, or we use mu per minute. Also can given intramuscular, also can given, right? Maximum dose for pregnant women is 40 ml per hour or 40 m unit per minute. Prolonged Pitocin infusion can lead to increase the postpartum bleeding, started at 1 to 2 m unit per minute, right? Also, we follow the hospital protocol. Other life-saving medication we use called magnesium sulfate, shortly called MAXSULF. So magnesium sulfate is the agent most commonly used for the treatment of eclampsia or prophylaxis of eclampsia in the patient with the severe pre-eclampsia. And it is usually given by either intramuscular or intravenous route. Let me read it. So MAXSULF electrolyte or anti-dysrhythmic. Basically, it is a magnesium. And magnesium is an electrolyte. And also, we can use as an anti-dysrhythmic. Means arrhythmia means heart rate is not normal range. Can be used as an anti-convulsant. Convulsant means seizure. When patient has a seizure with high blood pressure, it is called eclampsia. Without convulsion, high blood pressure with pregnancy, we call pre-eclampsia. So as a prophylactic in preterm labor, also for neuroprotection when given during the preterm birth. High risk medication. So we need constantly monitoring if our patient need to use MAXSULF. Adverse effects include flushing, drowsiness, diaphoresis means sweating, respiratory paralysis in very late stages, pulmonary edema, hypotension, circulatory collapse, hypothermia, hyperkalemia, hypocalcemia, and also depressed the reflexes. So in NCLEX board, frequently asking question from here, okay? So we need a special attention on it. So what are the special question NCLEX board asks? So if my patient needs to take MAXSULF for pre-eclampsia or eclampsia, we need to monitor for respiratory paralysis or we need to check the lung sound for pulmonary edema. Maxal can cause hypotension, blood pressure drop, circulatory collapse, hypothermia, hypocalcemia. So blood pressure drop, temperature drop, calcium level drop, but hyperkalemia. Potassium level go up, but calcium level go down. What are the most frequently asking questions from here in NCLEX board? And that one about the depress the reflexes. What next? Next, we can see a picture, the sign and symptom of the patient who have pre-eclampsia. So here's talking the mild pre-eclampsia, severe eclampsia. In case of mild eclampsia, we can see elevated blood pressure and elevated protein in urine, and also weight gain, water retention, and swelling. You see the picture, swelling, and here showing the urine mixed with protein. In case of severe pre-eclampsia, we can see patient have complete headache, change the vision, difficulty of vision or blur of vision, nausea and vomiting, and also pain in the abdomen and back. So if my patient have a pre-eclampsia, if we do not treat, pre-eclampsia lead to develop eclampsia. Or when patient has a sign symptom of pre-eclampsia with convulsion, we call eclampsia. So sometimes we call maternal high blood pressure, mildly increase, severe increase, or eclamptic phase, where the blood pressure is 160 over 110 millimeter of mercury or greater with convulsion. Convulsion means involuntary movement of the muscle. So if we say my patient have this problem, eclampsia or pre-eclampsia, what should we do? What are the management, right? So first of all, we check monitoring, give them oxygen, and also give the antidote. Next, here we go and just give a focus on what are the common sign, the first trimester, danger sign. When we see the danger sign, we could report to the doctor, right? Need immediate care. So what are the reportable danger sign? Like if patient have a burning sensation during urination, it indicates maybe patient have a UTI or pyelonephritis. Severe vomiting, and severe vomiting lead to the shock, hypotension, diarrhea, fluid loss, electrolyte imbalance. Fever, chill indicate infection. Abnormal cramping, maybe miscarriage, preterm labor, vaginal bleeding. So if a mother continue the pregnancy and mother would be amenorrheic, no menstruation, but if the bleeding is there, this is a danger. Vaginal bleeding indicate maybe miscarriage, Maybe ectopic pregnancies, who knows? We need to evaluate. And second and third trimester danger sign. Here we see again fluid, fluid prior to the 37 weeks. We call premature rupture of the membrane or placental issues, placenta previa, abruptio of placentae. Both can cause vaginal bleeding or change the fetal activities. No movement, fetal heart rate is too fast or too low or too slow. Persistent vomiting, right? Blur of vision, fever, chill, dysuria indicate urinary tract infection, shortly called UTI. Eclampsia of the face and hands, epigastric pain, or concurrent occurrence of flushed, dried skin, fruity breath, rapid respiration, or concurrent occurrence of clammy, pale skin, weakness, tremor, irritabilities, and light headaches. In this table, we can see compare and contrast. What are the acceptable sign, but it is discomfort. So normal pregnancy discomfort in each trimester. So if you educate your patient, they will be aware, concerned about it, and it would be easy for them to accept. So first trimester nausea and vomiting is common sign, but if nausea and vomiting continue second trimester or third trimester, it is danger sign. Increase the urination, breast abnormal sensation or tingling sensation, right? Second trimester discomfort but acceptable. Constipation, heartburn, pigmentations like linea nigra, or eat random things, pica. Leg crampings are normal if no suggestion of homensign. If homensign is positive, it indicates patient has a deep vein thrombosis, DVT. And DVT leads to the pulmonary embolism. Very important for NCLEX board exam. In the third trimester, leg crampings, hemorrhoid, back pain, and urinary frequencies. What are the reportable danger signs? So if we say some of them or any one of them, we need to inform the healthcare provider. And also we need to monitoring if mother have it, like abnormal vaginal bleeding, abdominal pain, epigastric pain, visual disturbance, means maybe mother have eclampsia or pre-eclampsia, severe or persistent headache, change in the fetal movement after quickening, painful or burning urination, edema of the face, feet or hands, sudden rush of the fluid, rupture membrane. We call premature rupture of the membrane. Elevated temperature above 101 indicate infection. Persistent vomiting after the first trimester. Absence of fetal movement after quickening. Next important topic here about the labor. So here, talking of the true labor, right? And pattern of contractions with the cervical changes. No cervical change, no labor. So what is labor? So labor is the process by which the fetus and placenta leaves the uterus. And during the delivery, or delivery can occur in the two ways. One is vaginally, means through the birth canal, or by a cesarean section, means surgically delivery, right? So here, first of all, we have to know what is the true labor and what is false labor. The true labor, the contraction, frequency, duration, and pain should be increased in process of labor, like contraction of the uterus. In case of true labor, it is consistent pattern. In case false labor, inconsistent. Frequency increase progressively, but false labor inconsistent. Duration increase progressively, but in false labor, inconsistent. About the pain, increase progressively, inconsistent. And cervix dilated and effacement occur, but here false labor, insignificant the change. In this picture, we can see the different stages of labor. The first stage here, stage 1, or first stage, second stage, third stage, and fourth stage. The stage 1, basically dilatation or dilation. The stage of cervical dilation begins with onset of regular contractions and end with complete dilations. So the stage 1, first true labor contraction until complete the effacement and dilatation of cervix. So again, it is subcategorized latent, active, and transitional. The latent phase is 0 centimeter to 4 centimeter dilatation of cervix. Active phase 4 centimeter to 7 or 8 centimeter dilatation of cervix, and transition 8 to 10 centimeter cervix dilatation. In the stage 1, we also check the presentation, effacement, and station. Presentation means the part of the fetus that is coming first, and effacement means the thinning of cervix, and station means the level of fetus head in relation to the ischial spine. And next go the stage 2, we called birth or expulsion, or second stage. Stage of expulsion begins with complete cervical dilatations and end with delivery of the fetus. So stage 2, complete dilatation and effacement of the cervix until the birth of baby. And second stage, the bulging of perineum is an expected findings. And third stage, or stage 3, we called placental stage. Placental begins immediately after the fetus is born and end when placenta is delivered. So the stage 3, birth of the baby until expulsion of placenta. Also inspect the placenta for 2 arteries and 1 vein. This is the question NCLEX board asks. And the fourth stage, or stage 4, means delivery of placenta until the mother's condition has stabilized. So maternal hemostasis means blood loss, fluid loss, stabilized stage, begins after the delivery of the placenta and continue for 1 to 4 hours after delivery. But the first stage or stage 1, second stage or third stage, the duration is varies. It depends on primipara or multipara, right? So this is the very basic about the labor.